Thank you. Thank you, Mr. Chair. Thank you, everyone, to join this meeting. Actually, in China, it's late. So my topic is HIFU clinical application for liver tumor and case report. And this is our hospital. It was founded almost 130 years ago. And this is our excellent HIFU team. You can say of them. And I'm one of the member. Well, also our center is the national training base for HIFU treatment, which was from September 2005. During last 20 years, I am lucky to have been working with over 500 doctors in 120 clinics from 29 nations and regions. So in my experience, I have cases with the tumor in the head, on the chest wall, in breast, in the liver, in the pancreas, and in the kidney. Also, the benign diseases in uterus, the tumor in leg, in adrenal glands, in the bone, the tumor inside the abdominal cavity, and even on the bottom of the feet. So sometimes I see the indications for HIFU ablation is from head to feet. Here, there is a video to show a tumor on the chest wall, the case from IEO, Institution of European Oncology from Milano, Italy. We see the tumor right on the chest wall here. It was divided into slices, and we put the focus right on the tumor. One solution, one gray scale change. And dot by dot, we ablated the tumor completely. After the final one, I put my finger into the water tank to touch the skin because it's so close to the skin. I touch it to make sure if there are any burn happened. So finally, we found out that nothing happened, no injury to skin. And the tumor was ablated completely, even with the nutrition blood vessels survival from the HIFU treatment. We use the value of gray scale change to indicate the local ablation. Generally speaking, if the value changed 10 units, we say it is ablated. That means the necrosis. So far, we have two clinic guidelines in China. The first one was published in 2005. The second one was published last year. It indicates us the indications for HIFU ablation. So there's a question, what is the role of HIFU ablation or HIFU treatment playing in treatment for malignancies? I have two stories. The first one is for breast cancer. In 19th century, the surgical treatment is a standard one for breast cancer. The 5-year survival was 30% more or less. And 50 years ago, it was thought that the local therapy have no influence on survival. The surgical treatment plus the systemic drugs together, it prolong the survival time. Right now, the long-term survival rate for early stage breast cancer is over 90%. The second story is for osteosarcoma. During the year, the pre-chemotherapy year, the long-term survival is only 20% with the surgical treatment only, but with the chemotherapy, such as the neoadjuvant chemo and neoadjuvant chemo, that means the modern chemotherapy year, it achieves a long-term survival rate over 60%. The same story happened in our center. We found that for those bone malignancies with the 2B stage cancer and chemotherapy, we achieve almost 8% long-term survival. So I believe that there are two foundation stones of tumor therapy. One is the systemic treatment with the chemo, TKI targeted agent, immune treatment, and the local treatment is surgery, HIFU ablation, radiation therapy, thermal ablation, TAE or TSAE. So I have two cases to show you that the first one, we say that HCC plus the right adrenal gland metastasis is a stage 4 when the patient was 45 years old. We chose the TAE plus HIFU treatment for that. Finally, we got a complete CR response after TAE plus HIFU. After that, we have a very good long-time disease-free survival of 17 months. But after that, we found that a new tumor appears on the right portal vein tumor thrombus. We use HIFU ablation again to ablate it and to keep the blood supply from this right branch of portal vein to protect the liver function. But unfortunately, we found that the PVTD happened to the left portal vein and more and more. We ablated the PVTD, but finally we lost this patient at 36 months. The second one is with HPV infection and no antivirus drug. So this patient was diagnosed as primary liver cancer, HCC plus PVTD in another hospital. The sulfidable was performed as a first-line TKI agent. But 3 months later, the sulfidable did not work well. After that, we choose a TAE plus HIFU to ablate the tumor. After that, we say the main body of the tumor was ablated, but the satellites lesions around it was not. Then we change the medicine to regorafenib as a second-line TKI agent. With that, 1 month later, the primary lesion shrunk, but we found a new lesion happened in segment 7. We decided to use regorafenib more time. On 5 months, we found that the tumor, the newly lesion in segment 7 is larger. So we performed another TAE plus HIFU ablation for that. With the economic reason, there is no post-HIFU CT. After that, we found that the tumor grew bigger and bigger and invaded into the right hepatic vein, even with the IVC. So at this moment, it's on 2020, the price of the medicine was cut off. So it's possible to use PD-1 plus regorafenib together to control those disease. Luckily, we found that the PD-1 plus regorafenib works well. Only 2 months later, we found that the tumor was much smaller than previous one. So the PD-1 plus regorafenib continues. Go on. At 26 months, we see no tumor thrombosis in IVC, but a tiny one in right hepatic vein. And right now, this gentleman is still alive. The follow-up is with the follow-up. So I think that probably there was no such best therapy for the patient, but with an appropriate treatment for patient, sometimes we need to try to find out a good local ablation plus an effective systemic agent together to control the patient and to prolong the survival time. So there are already published articles to show the effective affection of the HIFU treatment for small HCC. This one from Japan, we say the tumor was ablated completely and with a larger enlarged ablation. And this is from our colleague, Queen Mary Hospital. They compared with the results from HIFU ablation and RFA. It was found that the same OS and the same DFS was indicated. And then this one, this article was compared the recurrence after HCC resection, the diameter less than 5 centimeters. Those patients was divided into two groups. One is with ultrasound guided HIFU and ultrasound guided RFA. The other one is with open approach RFA. Finally, we found out that for all cases, the DFS and OS are similar. For cases under ultrasound guided therapy methods, the DFS and OS are similar too. And this one is from our center. We found that the patient with HIFU only compared with HIFU plus TACE, the OS 2-year was 89%. They are similar too. So we believe that for the small HCC, HIFU ablation will play a great role like other local thermal ablations such as RFA. They should be with the same results and with the same complications. Also, we have experience with HIFU ablation for large HCC. Sure, the long-term survival will be worse than those from small HCC. Our colleagues published articles from here, and this one is from our hospital. And there is a meta-analysis to involve 9 controlled trials with over 700 cases. It says that TACE plus HIFU ablation improved the tumor response and the 1 to 3 year survival. So another meta-analysis involved 42 articles and over 5,000 subjects. It says that also says the TACE plus HIFU appears to be the most preferable therapy. We believe that the TACE plus HIFU ablation together will prolong the survival time and with better survival rate. So, and there are some special conditions. Back to these published articles, this group patient is with the size over 7 centimeters with 42 lesions, all of them near major hepatic veins. We see that the tumor in segment 1, 2, 3, 4, and right or left lobes, and near IVC right middle left hepatic veins, and the portal vein right or left branch of the portal vein. We found that there is already with survival benefit, and we see that the tumor near the portal vein here, and the portal vein here, and the hepatic vein here, and IVC here. We found that there was no major blood vessel injury observed in all of this group. So we believe that just like the case we have seen from IO Italy, the blood vessels will be safe from HIFU ablation. And if the tumor was blocked by the ribs, as we all know, the therapeutic ultrasound will be reflected by the bone tissue of the rib or the calcification. So it needs breath control to move the tumor from behind the rib side into the interspace between two ribs. With this, the therapeutic ultrasound will reach the tumor. If there was a large size tumor, it happens the same. For those part appears in the interspace between two ribs, it could be ablated as routine. And with the breath control, we move the blocked one part into the interspace between two ribs. Another method is to intrapleural cavity injection. This picture shows the normal saline injected inside the pleural cavity. This is the liver, and this is the dome. Rib is here. It is a black shadow in the ultrasound image, and this is the end of the long tissue, and this triangle part is the normal saline. With this, it will create a good acoustic pathway to help us to ablate the tumor completely. Say this is a case, a male with 42 years old with APCC. We say the tumor was blocked by the ribs here, and here, and blocked by the lung tissue. With those two methods, we could ablate the tumor completely. And then this case is from our colleague, Professor Tong Yang team. They are from the Ningbo Huamei Hospital of Zhejiang, China. This tumor is between the liver and the stomach. We found that the tumor was ablated and shrunk after 1 month, and there was no visible injury happened to the liver or the stomach. And this is another case from Professor Tong Yang. We say a tumor in segment 4 near the heart and near the left branch of portal vein. We see here the left branch of portal vein here, and this is the dome, and it's a very tiny one. After that, there is a strong hyperechal change happened, and with the Solview injected under the CEOS contrasted enhanced ultrasound, we say it was ablated completely. This one is from Professor Tong Yang too. We found that this part was ablated previously, but a newly one appears here, and a very tiny tumor. See, this is the IVC. It's so close to the IVC, and during treatment, the hypoechoic change happened again. We see the IVC clearly. So just like Professor Simon shows, the tumor near the dome could be ablated completely. This case is from our team, and this one is from University of Hong Kong. The same, Well, this case is from our team. Say this old gentleman is 81 years old with the pancreatic cancer, liver metastasis. We see that 1, 2, 3, 4, 5, 6 lesions. Six lesions ablated in one HIFU session on November. It's 2.5 hours to complete those 6 tumors. We say the tumor near the diaphragm and near the portal vein and even near the duodenum. This is a success ablation. Well, this case shows the natural course of a patient with portal vein tumor thrombus. Let's say on September 14, 2016, the tumor invaded the one of the branch of right portal vein. Only 1 month later, it grew into the other branch of the right branch portal vein. It was said that the natural growth is 12 millimeter per month. So this is another case. We can say that the PVTT right here on the right portal vein with the sodication, I have got the hypertrophic change right here. So we could ablate the primary liver cancer and the portal PVT together in one session. There is a published article shows that for those patients with PVTT invaded 2 branches of portal vein, there will be survival benefits. There are cases, say this one is tumor in segment 4 with the PVTT on left branch. After ablation, the size of the primary HCC shrunk and the PVTT inside the left branch disappeared. This case is with a large one in segment 5 and segment 6, which was not shown in this slides. But we can see that the tumor invaded the right branch of the portal vein. 1 month later, we say the PVTT was ablated and the flow of the right branch of portal vein appears again. Well, this is a case. We say a huge tumor here, and it invaded into the right branch of the portal vein. With the TACE plus HIFU treatment, we say the tumor was ablated completely, and after that, another TACE performed. We say the size of the tumor gets smaller and smaller, and no more PVTT appears in the right branch of portal vein. Well, this case shows a tumor near the gallbladder. We found that the tumor was ablated completely, but no injury happened to the gallbladder. This case shows a tumor near the colon. We say that it was ablated completely, but no injury to the colon. This tumor is near the HeLa region. We found that after ablation, and this one shows the biliary flow after stent placement with the pressure of the tumor, we see the stent was pressed. There is only a thin line. After that, we see with the shrunk of the tumor, the stent opened widely. Well, this case, the next cases, I'd like to share some video to you. And we see this one was nothing on 2011, and on 2013, there is a small HCC happened on segment 8. With the first HIFU ablation, it is a successful CR response. But unfortunately, this year, we found a new grew tumor on here again, and we ablated it completely.
Professor Zhou, please, 2 minutes to finish, please.
Oh, okay. I will speed up. We'll go ahead. Another one. This is a cholangiocarcinoma. We see here, and ablated completely. This is before, and this is after. And this case is near the dome. It's a colon cancer with liver metastasis. And then this is another one with a single large tumor. We see it's right here. And after that, it looks like something left. So we performed a second one. After that, a complete ablation and with size shrink. This one is HCC after recurrence. After resection, we ablated it with that, the size shrunk. Well, I have no time to show share the video. Anyway, I can make some conclusions. First, I believe the HIFU treatment, HIFU ablation is one alternative local thermal ablation method. It could play a tumor ablation, drug target delivery, and immune upregulation function for the patient. We found that it is safe for large blood vessels, and there is no limitation for size of a tumor. And it could be a conformal thermal ablation. And finally, I believe that it should be with systemic treatment agent, TKI, PD-1, PD-L1, CTLA-4, chemotherapy, together to benefit the patient more. So I believe in the future, HIFU treatment or HIFU ablation will be a good tool, a good method for us clinical doctors, and it will be benefit for more and more patients. HIFU high life. 谢谢大家 ，Thanks, Dank, Grazie.